I am so excited to share my latest resource, downloadable print your own flashcard decks. These have been created following my many years working with children of all abilities in the clinical setting. And my themed flashcard decks work. The kids love them because they're engaging and they encourage movement, learning, coping skills, and just plain fun. From dinosaurs to Halloween, each deck includes suggested and themed centering techniques, warm-ups, guided meditation, relaxation, yoga-based movement, and games. Each card in the deck includes multiple yoga-based practices to choose from, meaning you can enjoy a different experience each time you play, and there will always be something that's suitable and accessible for the child you are working with or the setting you are working in. These are highly adaptable tools, and they work in the classroom, hospital, office, or home setting. Download and print on card or paper stock of your choice and enjoy creative, adaptable, and accessible adventures for many years to come with children of all abilities and in all settings. I promise you will not regret adding a set of 2 of these to your resource collection. And keep checking in. I have created a lot of these decks over the many years I worked in the clinical setting with children of all abilities, and I'm slowly updating and releasing them to the public so that all children can benefit from these wonderful tools.
Hi, I'm Lisa Roberts from Yo-Yo Yoga School, and welcome to session 11 of Movement, Meditation, and Mindfulness, a training program for pediatric professionals, educators, and parents. Today's session is part 4 of a segment I have called Essential Elements, and we'll be covering what I call the 3 C's today: communication, connection, and class management. So when we talk about communication, we will explore communicating with the children you're working with, your students, how to communicate effectively with parents and caregivers involved in the child's care. We'll also explore how teaching itself is a form of communication, and we'll also be exploring the 4 styles of learning. Because if we're not teaching to meet a child's learning style, we're not teaching at all, and we're certainly not communicating in a way that the child responds to. So these are really all the 4 key elements of effective communication when teaching movement, meditation, and mindfulness to children. And in fact, teaching anything to children and adults of any age. So before we go on, I just want to touch on nonverbal communication. So we all know what verbal communication is. It's talking and giving verbal auditory instructions. But we also want to be aware of nonverbal communication when we're working with children. And nonverbal communication are facial expressions, body movements, body posture, any gestures we make, eye contact, touch, space, being right up in someone's face when you're talking to them or giving them a little space, or even that body language of being distant and turning around can be a very strong form, send a very strong message in a nonverbal way. And voice and tone, of course, are core nonverbal communications. So when I refer to nonverbal communication, these are some of the things that I am talking about. And it can be a combination of these things I've just pointed out, or it can be just, one. So communicating with kids, we want to be aware of your tone of voice. You want to be aware of your body language and your nonverbal cues. And that's when you're talking And also when you're listening, you want to be mindful. If I'm looking around the room with my arms folded while you're talking to me, it's probably going to be a pretty strong indicator that I'm not really listening or paying attention to you. But if I'm sitting and I'm not fidgeting and I'm making direct eye contact with you, or even nodding along to show that I'm giving you that nonverbal response that, hey, I'm listening, keep going, then you know I'm engaged, you know I'm listening. So that's a perfect example of that. I'm going to pay attention to the child's nonverbal cues too. Again, a child who's making that a face like, I get it, that can give you the clue that what you need to explain what you're teaching in a different way. And that's just one example. Or the child may be indicating, hey, I didn't understand what you said. The child may also indicate, hey, I have no interest in being here. My mom made me come take this class with you. So just being aware of these nonverbal cues can open up the lines for communication to really help support the child and provide what the child needs. Positioning yourself eye level with a child. This is very important. You don't want to be that big adult towering over a child, talking down to them, but positioning yourself so you're eye level and at the same eye level and at the same height as the child. And then it's much less intimidating, and you're showing the child, hey, I'm here, I'm listening, I'm with you, and that we are equal. And you're showing it's a sign of respect as much as a tactic to not be intimidating. Being aware of the child's developmental stage is extremely important to be able to use vocabulary and an appropriate approach and tone to your session as well. Verbal and visual cues together are very, very helpful. And when you think about movement, meditation, and mindfulness, and a lot of the strategies we've been discussing in this webinar and what we'll explore moving forward, we are providing visual and verbal cues. And that's what I love about this, to actually get in there and do the movement with the child and be doing it together with the child as you're providing the verbal instruction is very, very helpful. And you can add tactile clues in too. And an example of that when I'm working with children, particularly one-on-one, if I'm going to use the example of bilateral coordination. A lot of kids may be struggling with that. It comes into play around the age of 5 to 8 developmentally. Kids begin to be able to process and move their body in a bilateral way. So if I am instructing a child to move I'll just hold my right arm out and I want to move my right arm. So I might be saying right arm and left leg, and as I say it, I gently tap on it. And that's that little tactile cue, even though I'm giving the verbal cue, right arm, left leg, and then as I say it, I tap. So if the child was laying in front of me, I would tap their right leg their right arm and their left leg as I said it. So it's just that little nonverbal cue, or lift your shoulders. And some of you who have observed the previous webinars on mindful breathing, you'll notice sometimes I point to my nose. So that's just my little nonverbal way of telling kids, hey, let's breathe in through our nose when we're doing a breathing technique. So like take an easy breath in, and that's just become habit for me. It doesn't matter what age I'm teaching. Even when I'm teaching adults, I find that I do that now because it's just become so ingrained in my style of teaching, just adding in these little nonverbal cues to support the verbal instruction that I'm giving. Simple and literal instructions and explanations, especially when working with young children. You don't want to get too metaphorical or too abstract. Of course, we want to be imaginative and creative and fun, but some of the instructions as well, just to keep children safe and so that they are clear, so they can process and understand in a way that's developmentally appropriate to the child. We do want to use quite simple and literal explanations. Permission to opt in and out. Sometimes as an adult, I'm not feeling it when I want to go for example, a yoga class or for a run in the park or something like that. So giving the child that permission to opt out. And I often do that. And this is especially when we're working with groups, and this is communication and it plays a little into class management as well. If a child doesn't really want to be there and we're forcing them to do it, typically there's going to be some behavioral stuff coming up, and then we may start becoming disruptive to the class. But if you're respectful of that child, is to say, hey, you don't want to join, you don't feel like it today, that's okay. I typically, when I have a group session, we'll set up a little area. We have some activities like a Hoberman sphere and maybe just some comfortable cushions, and an extra yoga mat, some coloring pages of mandas. So it's all relating to mindfulness, and it's just you can hang out in that little area there, the chill out area, and you can do another activity. You can take a nap if you want to. This provides the child a choice, and then of course the option to opt in as well. It's like, and hey, if you see us having fun and you change your mind and you want to come back in, you're welcome to join in anytime. And this can help to prevent a child that really doesn't want to be there or is just not feeling it that day. It's respecting their wishes, but it's also providing that opportunity for them to just provide what they need to themselves. And it lessens your chance of that child just being forced to do something they don't want to do, and then potentially becoming disruptive to the class for the rest of the class. And the other kids, when there's one disruptive child, they're not going to have the opportunity to learn because it's going to be taking all of your attention as a teacher. So I just give the opportunity to opt in. It is respectful to the child, teaches the children to really reflect and say, hey, this is what I'm feeling, and I do have a choice, which I think is important in life for children to understand. Hey, I do have a choice, and if I can say no, and I can change my mind, and I can opt in, and this is okay. Of course, you can explain this to the parents too, so the parents understand what you're teaching here and what your whole philosophy is on it. But I don't believe in forcing children to participate in movement, meditation, and mindfulness. Of course, we make it so fun and engaging, they want to anyway. Permission before providing hands-on assist or adjustment. We're going to talk about this when we talk about developmentally appropriate movement and creating sessions for children that are developmentally appropriate. But I really don't offer hands-on assist for younger children unless they look like they're going to hurt themselves. But we always need to ask permission first. You don't want to just place your hands on a child without asking them. You don't know if there's a past trauma. Maybe you do. It depends on the capacity you're working with the child. But if you don't know the history, if there's any past trauma, or maybe there's a trauma that hasn't been disclosed that the child hasn't expressed yet. If you're not familiar with the child, you don't know if there is a physical injury or maybe they fell off the bike the day before and they haven't told you, and there's a scab under the t-shirt. You just don't know. So always asking permission first is respectful of the child's space and the child's body, but also we're being sensitive towards any the potential of trauma. And that's just in any form. Even for yoga teachers who I've worked with who are teaching adults, this is just a very, very important part of the learning process as a teacher, just to be very respectful of the student and their personal space and their body. Even if they look like they're going to hurt themselves, it's like, do you mind if I place my hands on you and help you here? Always ask permission first. Expectations at the start of the session, communicating that from the start. And we're going to talk about that. I have some slides coming up that provide my sample introduction that I use for younger children and teens. You don't know what you don't know. So if you communicate clearly what your expectations are at the start of class and what the students can expect, that gives the children the opportunity to ask any questions, and then you're setting yourself up for a nice, smooth and fun movement, meditation, mindfulness experience because you've approached everything from the start so the children know what you expect. Encouraging feedback and questions from the children. This is their experience. This is exactly what I was talking about at the start of this webinar. Teaching is communicating. It's a dialogue. So the feedback from the student can help you to either change your approach and the way you're teaching something. If they're not understanding, if they're not responding to your style, you've got to teach to a style that works for that child and that they respond to. Maybe you begin to learn what the child needs more of and what is helpful for the child. and what you need to provide less of. So it's a very, very important part of the process and the journey of working with a child and helping them explore movement, meditation, and mindfulness. Asking questions yourself, listening, truly listening to the responses, and responding thoughtfully and truthfully. We want to be as truthful as we can with children. The only way they're going to learn. So we'll move on to the next slide. Communicating with parents and caregivers. Very much the same thing as working with children. Ask lots of questions, respond thoughtfully, listen well. I like to ask more questions where needed. If I'm working one-on-one with a child and the parent has specific goals and maybe the child is struggling with something or there's a challenge and we're working on that, that may change, and it may change externally outside of our sessions. So I always like to check in with the parents each time I work with the child, before and after the session. I like to check in if I have intake forms from my one-on-one sessions with children. I like to update those, every 6 to 12 months and just check in with the parents to see if anything's changed. Sometimes the parent may not be aware that we can approach things in movement, meditation, and mindfulness. And just through these conversations and through having open communication, something that they may have forgotten will come up in this conversation. So, oh, by the way, yes, she was with her PT last week, and this is what they told me. And that's something I can take on board to help further support the child or reinforce something they're working on at school, academically. So there's so many different ways we can draw in other aspects of the child's life and integrate it in a supportive way in the movement, meditation, and mindfulness session. And this only comes through communication, because the parents, we don't know what we don't know. So if the more you communicate what you can do, what you can incorporate, and how you can support a child in the session, the better and the more beneficial for the children it's going to be. Listen and responding thoughtfully and honestly. So maybe a parent has a question for you. Do you know how to support my child with this certain condition? And maybe you don't. It's like, if you don't know, it's okay. We can't be experts on everything. So, no, can you tell me more about this? Respond honestly. Or can you tell me more about this diagnosis? Can you tell me more about this situation? How can I help? Maybe I can research. Maybe I can speak with another professional about this. Or maybe it's time, and I've done this. There's been many situations where we've tried all I can do, and it's like, this isn't working, this isn't supporting the child. We need to try maybe a different teacher or maybe a different setting, and passing it along to somebody who is able to help the child. And that's really the core of what we're doing here. We're working as a team with the parent, with everyone involved in the child's care, to find what is best for that individual child and how you can support them the best. And this all comes from communication. Again, with the parents, communicating expectations. I like to communicate my style of work and what we'll be doing in the class. And this can just be very, very helpful to provide the parent with the opportunity to say, I don't want that. I find the word yoga is very widespread now, so people have a much deeper understanding of it. My work is movement, meditation, and mindfulness, but the word, because it's yoga based, some people may halt at the word yoga, and because they are concerned it's religion. So by having these open conversations, you can help a parent understand exactly what you're teaching, and whether there is some yoga philosophy or whether you're going to completely omit yoga philosophy. Some parents may not even want meditation. So if we have that open communication at the start, they know what to expect from the beginning. Any boundaries on the parent's part or our mind can be established, and we can be meeting everybody's needs. So this is why communication is so vitally important. And encouraging parental participation. I love to involve my parents. Maybe they don't want to stay for the session, but I always send home homework or little videos or little handouts of techniques that the child's responded to encourage the parent to practice with the child. I think it just helps to encourage that practice beyond your session. And teaching is learning. So you're learning just as much. Communication is best described as a dialogue between teacher and student, and that's a really big part of my philosophy. You're learning too as you go. You're learning about the child, you're learning about what the child needs. So I find I get as much from the kids I work with as I'm giving them. Listening and responding, verbal communication. So you've got to listen, you've got to respond with strong verbal and clear verbal communication. Observing and responding to nonverbal communication. So you want to be aware and respond to that appropriately as well. Be aware of your verbal and nonverbal communication. Understanding the 4 styles of learning is important. So we're going to get to that in a moment. And identifying what style of learning your student responds to. So you want to approach mostly in that style, but as we'll talk about later, you still want to be exposing kids to experiences they may not ordinarily seek out. So if you're approaching a child, for example, is an auditory learner, okay, they're going to respond very well to verbal instruction, but you're going to expose them to some tactile and kinesthetic learning along the way as well, because they may not ordinarily seek that out. And you want to instruct in the best way that supports your child's needs. So again, if it's an auditory learning, an auditory processor, if your child processes by listening, then that's going to be a core part. However, exposing them to other experiences is also vital too. So understanding the 4 styles of learning. When you think about a well-balanced movement, meditation, and mindfulness session, and a lot of the stuff we've done so far, we are hitting all learning styles. So that's why I love this. And this is why I love when we talked about theming in the previous webinar, to bring in academic learning into your themes. You can really help children thrive because we're providing it in a wonderful way of encompassing all the styles of learning through movement, meditation, and mindfulness. And if you draw in what they're learning academically, you can really reinforce that stuff for them. So, and it's, again, a great opportunity to provide children with experiences they may not ordinarily seek out. If I'm an auditory learner, I'm going to gravitate towards that style because that's where I get my information fast and that's where I'm comfortable. But being exposed to other learning styles is helpful too, developmentally. So let's start with visual. Visual processes learn through observation. So they pay close attention to body language and facial expressions. So you want to support any verbal instructions with an activity or a visual aid of some description. So a perfect example, when we're talking about the breath, the lungs expanding and relaxing. So I'm giving you the verbal, but I'm also giving you the nonverbal as well, the visual cue. So visual learners have great imaginations. They're very visual, imaginative. They think in pictures. And so to demonstrate movement, and when you think about it, when we're doing our movement, I've always encouraged, and again, this is also part of communication, jumping in and doing the movement with the child. So you're not just standing there with your arms folded instructing, you're demonstrating, you're providing that visual cue and doing it with the child. You're playing with them. I always say play. You know, when I used to be 100% yoga teacher, it's let's play yoga. Now it's let's play movement, meditation, and mindfulness. Let's play some games. Let's play and have some fun. Or maybe it's just my theme. Let's play dinosaurs today. And then we're doing movement, meditation, and mindfulness all around dinosaurs. So it's play. I'm jumping in and playing with you. We're interacting together. We are level. We're equal. And that's a very important part of kind of the whole package of teaching this method. Demonstrating all movements and activities, practicing along with a child, I've just covered. I'm just making sure I don't miss anything. And setting up your session. So this is important for visual cues too. If you have a room full of visual learners or you're not sure, and you don't know if you're teaching a group of kids that you are not familiar with, so important to think about kids who are auditory, kids who are visual. you will set up the room so they can all see you clearly and they can all hear you clearly. So that's very important too. So auditory processes, we've already discussed, learn through listening. So our kiddos respond to discussion. They require verbal instructions to support visual demonstration. So we're, again, talking through, guiding with verbal instructions to support the visual instruction of whatever activity we're doing, whether it's movement or describing a meditation mindfulness activity. We want to provide very clear and simple instruction for our auditory processes, and using age-appropriate language and a clear tone, and setting up your session so all kids can hear you. So we want to be seen, we want them to be able to hear us. So tactile processes learn through touch. So these kiddos respond to projects and activities. Doodling and drawing can aid memory as well. So these little crafty projects we do in our movement, meditation, and mindfulness sessions are really wonderful for these children. Hands-on assists may be helpful for and supportive for tactile learners, remembering to ask for permission first. But sometimes the placing of a hand, when you're describing a stretch or a body position in a movement session, I might be providing the visual and verbal cue, but sometimes the child might need help to place the hand in the position, or that tap that I mentioned earlier, breathe through the nose, or you lift your right arm. So these are all just helpful ways to support a child that requires that tactile input to help them process. Any additional sensory input may be helpful for kiddos who are tactile processors. Introducing meditation and mindfulness through activities. So more active meditation will be activities that we discussed in the earlier webinars, will be very supportive for children who are tactile processors. And movement is a tactile experience. So again, if we're and tactile learners, if they're mostly tactile learners, they can really struggle in the typical classroom setting, which tends to be auditory visual and rely heavily on auditory visual learning. And tactile kids can struggle, and kinesthetic learners can struggle in this environment. So drawing in and theming the sessions to support the academic learning through these movement, meditation, mindfulness sessions can be super beneficial for kids who are tactile and kinesthetic processors. So we move on to kinesthetic processors. These kids learn through movement and action, so physical activity and a hands-on approach to learning. So these kids are the ones that can be kind of a little fidgety in a typical auditory and visual environment. So again, theming these sessions around the academic learning can be super supportive for these children. And again, the movement meditation and the mindfulness and meditation activities are much more are received a lot better for these kids, and much more supportive to meet their needs, especially in the beginning stages of learning meditation and mindfulness. So that's communicating. And being aware of the 4 styles of learning is a very, very big part of communicating, being aware of your verbal and nonverbal cues and communication both ways, as well as the child's core elements. How do we connect with children? You want to center yourself first. If I'm working with a child and I have not centered myself and I'm not present, I'm thinking about, did I pay my insurance? What time do I have to be home for dinner tonight? And oh my gosh, did I leave the oven on? I'm not paying attention to the child. So even if life is busy, there's a lot going on, and we often do have things weighing on our minds, and then we have to go to work. But to be able to take that moment in between each session when I work with kids, just to take a breath and let go of my day and my stuff, for lack of better, do a little breathing or do a little focusing or do a little centering technique, whatever works for you, before you enter and work with a child or children so you can be 100% present for them, is what's going to benefit children the most. Being eye level to show that respect and to truly connect authentically with a child and say, hey, I'm here for you and I'm listening to you, and what do you need? And that's how you're going to support and authentically connect with a child or anybody you're communicating with or working with. Listen to what the child says, acknowledge and respond. Sometimes in a group setting, a child will be, or even one-on-one, will be talking about things that are unrelated to your session. I still acknowledge it. It's acknowledge, respond, and then re-engage and move back on, redirect back into the session. So that's how and that's a class management tool as much as it is just to respect, just show the child, hey, I'm listening. Yep, that's, I heard you. Let's talk, I've acknowledged it, and now we can go back to this. And that's respecting the child as well and helping to connect with them and build that trust with the child. Again, connecting with children, you're showing respect by asking permission before hands-on assists. Fostering a safe and nurturing environment. Children learn if they feel safe, if they feel secure, if they feel heard, if they feel respected, if they feel loved. So by creating that environment when you're working with children, teaching anything, it is vital. Encouraging peer support. Encouraging in the group setting children to take turns to communicate clearly with their peers, to praise their peers, to see their peers, to be empathetic and sympathetic, patient and kind, and to take turns. These are all really core social values and a very important part of communicating and connecting with children and teaching children and supporting their positive connection with others. Never, and this is a really important one, never assume just because you're older that you are wiser or smarter than a child. The children have a lot of wisdom and you can learn so much from them. So just staying open in the session and really genuinely, authentically connecting and communicating with children. You will learn so much, but you'll also be able to provide engaging and beneficial sessions for the child if you keep an open mind and an open heart and truly listen. So class management, you want to clearly define your guidelines and expectations with parents, kids, and caregivers alike from the start. And this it makes it so much smoother going forward. For example, I think I gave the example a little earlier that some parents may not be comfortable with meditation. So then you'll know by explaining exactly what it is and how you'll be teaching it. My metaphor for it, or my way of explaining meditation, is it's just a fancy word for present moment awareness, and this is what we'll be doing. And explaining your teaching method or your teaching style to a parent and seeing if they're comfortable with it. And if they're not comfortable, then that's okay. I respect your wishes. I will not approach that subject. This is what we will do. So it's defining that from the beginning, what to expect, how you're going to teach, and keeping those lines of communication open. Everybody is having their needs met and respected, which is very, very important. I like to, in a group setting, decide on a sound, such as a clap or a chime. I have my chime here. And again, setting up the expectations and boundaries at the start. If you hear this sound during class, we stop what we're doing, we stop moving, we stop talking, and we raise our hand. Or same for the clap. Or perhaps the clap, everybody joins in and does the same clapping sound. And eventually, everybody will quiet down and pay attention to you. So I do this as a class management tool. It's much better than yelling or screaming or saying, be quiet. We're having fun. We're playing. It's going to get rowdy. Kids are going to get chatty. They're going to get excitable. If the arousal levels get too high or distracted or off on a tangent, or kids are chatting amongst each other, this is a nice way, a non-confrontational way to bring everybody back together, to connect together as a group, and then move on with what you were doing. And children respond to that very well. I find it's a great tool, and it's just so much better than yelling and screaming like the teachers used to do back in my day. Encouraging language, positive language, praise, encouragement is really that's what kids respond well to. So, and I like to move on to positive reinforcement is a wonderful class management tool. So praising the behavior that you are looking for, or the cooperation or participation that you're looking for, and that is positive reinforcement. So you're reinforcing what you are looking for, and maybe not paying so much attention to the ones that you aren't, unless of course somebody looks like they're about to get hurt, and then you will need to step in. Permission to opt out. Just having that nice an option for a child. It's like, if you don't feel like it today, it's okay. Just, go to the activity corner, find something to do, sit quietly, because the others and this will prevent the child from disrupting the others that do want to learn. And so again, as I mentioned earlier, respecting their needs and their desires in that moment. Permission to use bathroom, access tissues. And this is important, especially if you're going into the more quiet, introspective meditation. If a kid's laying there busting to pee and they're too scared to ask, they're not going to relax and get the benefits of the meditation. But if you've given permission from the start, it's like, if you want to use the bathroom, you can. If you want a tissue, they're right here. If you want to go to the quiet corner and just chill out and take a break, that's okay too. If you just want to sit on your mat and do child's pose, or lay and relax with a pillow under your head, that's okay too. So setting up these boundaries, and again, I'm just using random examples. You don't have to use any of those. You may have your own, and depending on what you're planning that day. But these are just examples of what you can do. Open communication with children, with teachers, with caregivers, with parents. This just really, really helps. Be honest about the progress. Be honest about any challenges that arise. Again, you're working with all of these. I like to think of them as the village that are supporting this child and finding what's best for the child. And by having conversations with the parents and and whether you are in direct contact with their teachers and their other caregivers or therapists or PTs, maybe you're not. But if you are, then you can have conversations with them, or you can have those conversations with those professionals via the parent. And just pass along any information, and again, keeping the lines of communication open can help with class management. If behavioral issues are propping up, they're propping up for a reason. There's no such thing as a bad kid. There is something going on, and it may not have anything to do with you or your class, but communicating openly with the parent. You can work with the parent and others involved in the care of the child to help find what it is the child is looking for, what they're asking for. And usually any kind of behavior is an expression of, hey, I need something. And you can work together to help find what's going to be supportive for that child. Not all kids come from a safe, nurturing environment. So just being patient, being firm, and being kind, and having the child's best interests in your heart is what are core and most important. So guidelines for toddler and grade school kiddos. Today we're going to move and play. We're going to move our bodies. We're going to each have our own mat. We're having our own space. And unless we're asked to move around or around as a group or to be the leader, we're going to stay on our mat. That's going to keep us safe, and we're going to enjoy our own space. So sometimes I'll have them trace out the space. Sometimes we put on body glue. So we do a little self-massage, which is a great centering technique. And when we put on this body glue, it helps us to stay stuck to our mats or our space. Maybe it's a square of carpet or a hula hoop or some painter's tape marking out our space. This just helps in a playful way for kids to just have a sense of their personal space and where they're going to stay on their mats. We're going to listen. I always say, how do we listen? We listen with our ears, and it's amazing. Our ears work better when this thing isn't working. So we're going to zip our lips, and we're going to make our ears work super, super well. And we're only going to open our mouth if we're doing some yoga sounds or some breathing or singing or any of these things that whatever it is, I know we're bringing into the lesson that day. And that's going to help us to listen better if we're just using our mouth for those things and not for chit chat. And then I'll reinforce it. It's like, so let's all enjoy our own space, listen with our ears, and most importantly, let's have fun. Let's get started. So I kind of set up my boundaries of what my expectations are. We're staying on our mats. We're not moving around. We're going to listen very carefully. We're going to be respectful of each other. And we're going to have fun, most importantly. So everything is set up from that intro in the start. So that's younger children. For my teens and tweens, I'll ask them to turn their cell phones off. And often I get those moans and groans. And again, this depends, it's very subjective. It depends on your environment. I'm referring to more a group of setting. Often if I'm working with a child one-on-one and my child, a lot of the kids I work with have special needs or they're critically ill. So I want them to keep their phone on. Mom might be trying to call them from work, or mom may just want to hear their voice and know that they're okay. And I don't want our session to take that away from them. So I'll ask the child, and usually tweens and teens can make that decision. It's like, I recommend we silence your phone at least, but if you're expecting a call or if you want to keep your phone on and near you on vibrate, or just so you can feel it or hear it or on a low sound, you're welcome to. So I let that, in that case, be their decision. Otherwise, typically, a general, typical teen-tween class, cell phones off and away. And I'll explain to them the iPad analogy. It's like, hey, if you've got your smartphone or your tablet with all its apps running and you don't forget to recharge it, it's going to die and the apps are going to all run slow if they're all running at the same time. So we're just like that. And that's what we're doing here. We're turning down all our apps. We're giving our body a break, and we're going to recharge our proverbial iPad or smartphone, and they get that right away. So that's, we turn them off, remove distractions, and allow them to focus on the gift of that time in this session for themselves, to make themselves feel really, really good and recharge. Another important cue or setup, communication I provide at the start of working with teens and tweens at their session is, hey, you are the only person in your body. Teens and tweens are going through growth spurts, and a lot of the stretches may be difficult for them to access. They're going through major body changes. So, for example, girls may have tender breasts, so some of these on the belly poses may be really uncomfortable for them. So again, you want to be watching for those nonverbal cues to provide an alternative and a support for the child. But I will just tell them, hey, we're all unique. Only you are in your body. You're the only one who knows what something feels like. So just because I'm asking you to do it doesn't mean you have to do it. If it doesn't feel right, it's okay. Just, give me a wave if it's in a group setting or one-on-one, and just say, hey, Miss Lisa, this doesn't work. And we will work together to find what works for your body. And so we provide that at the start. So they're not just trying to see that, oh my gosh, everyone else and the teacher's doing this and I can't do it, so I'm just going to force myself. And that can lead to injury or just discomfort or, self-judgment, any of those negative outcomes that we're just absolutely not looking for in movement meditation. Mindfulness is all about supporting the body and finding what works for each unique child and giving them permission to ask for what works for them. So again, just reiterate, we're going to have fun, no judgments. We're simply breathing and enjoying different ways our body can move and breathe. And that's really what we're doing. So that's how I introduce it to a young child or a teen or tween. So just to reiterate, communication, connecting authentically, and class management. And class management really you see how they all connect together. If you're communicating well, your class is going to be smooth and flow easy, whether it's a one-on-one class or a group class. If you're communicating well with the parents and the child, and you're communicating in a dialogue format where it's not just you, the expert, teaching, leading, you're working together and learning as you go and learning the child as you go, because every child is different. You're always learning. You may know a lot about movement meditation and mindfulness or whatever your field is. You may know a lot about it, that you don't know a lot about that child necessarily. So working together, you're learning together, and as a team with the child and yourself and the parent and all of those involved in the child's care, you can really create a supportive environment for that child to thrive. So that ends our session for today. I'm taking a short summer break, and we'll be returning in early August with some really great live webinars covering movement, meditation, and mindfulness games. And when I say games, it is fun and play, but we're also supporting child development in so many different areas. We're supporting physical development, social development, emotional development, cognitive development, sensory development, all through games. So that's a fun session. We'll be covering arts, crafts, and journaling, and how to incorporate these expressive therapies into movement, meditation, and mindfulness sessions to benefit children. We're going to be exploring developmentally appropriate and developmentally supportive movement, meditation, and mindfulness through each stage and age. And this is important. We want it to be appropriate to engage the children, but we want to support the development using movement, meditation, and mindfulness. So this is a really core section of this whole training program. And then we're going to move into movement, meditation, and mindfulness in the clinical setting. So that's in clinical outpatient offices as much as inpatient hospital settings. So we'll be exploring movement, meditation, and mindfulness and adapting it to these unique settings. Wellness and therapeutic practices that target specific wellness outcomes and to support specific diagnoses and symptoms that children may be experiencing. So these are health and wellness targeted practices that are yoga-based. So we're going to be exploring those in the series, as well as movement, meditation, and mindfulness adapted for the classroom and beyond. So we're not just in the classroom. Of course, we're going to do a lot of classroom yoga-based movement, meditation, and mindfulness, but we're going to explore out of school, after school programming and group sessions for PTs, and even integrating it into arts and crafts and academic learning and phys ed PT and things like that, all those kind of programmings, and how to merge them together and integrate movement, meditation, and mindfulness into the school setting and the classroom setting.